Imagine, if you will, this sort of quiet revolution happening in children's healthcare. The focus is shifting, not just treating symptoms, but really nurturing a child's whole well-being.
Hmm.
So today we're pulling back the curtain on this evolving landscape, complementary therapies, integrative medicine in pediatrics. We're exploring how families are looking at health in a more, well, holistic way.
It's a big shift.
It really is. And our mission here, for you listening, is to cut through all the noise and complexity. We want to give you the inside track so you feel genuinely confident, really well informed, ready to navigate this whole area with real clarity.
Yeah, to really get it.
Exactly. We're aiming for you to master this information like the elite professionals in the field. So we'll define this whole approach, unpack how surprisingly common it is, and then really dive deep. We'll conduct in-depth analyses of specific therapies.
Everything from supplements to...
Right. Dietary supplements, which are huge, hands-on things like massage, chiropractic care. Then there's the mind-body connection, ancient practices like acupuncture, and even, the really current complex stuff around cannabis and pediatric care.
It covers a lot of ground.
It really does. It's a fascinating journey, and we're planning to explore every angle, every detail.
And what's truly fascinating, I think, is how these practices have just quietly but really profoundly become part of pediatric care, often without those open, formal discussions happening between families and their doctors.
That lack of conversation is key, isn't it?
It's crucial because this area involves really intricate nuances. We're talking efficacy, safety, regulation. And these are often quite distinct from conventional medicine. Understanding those differences isn't just, academic.
No, it's practical.
It's paramount for delivering care that's comprehensive, safe, and actually effective for kids. And this landscape, it really is evolving so fast. A deep understanding is just essential now for anyone involved in pediatric health.
Okay, so let's start right at the beginning then, the foundation. What exactly is integrative medicine, especially when we're talking about a child's health? It sounds kind of broad, maybe a bit abstract.
Right.
But I assume there's a pretty specific framework behind it.
Absolutely. And the core definition, particularly for pediatrics, is incredibly comprehensive. It's not just about fixing a single problem. It focuses on promoting a child's physical, mental, emotional, spiritual, social, and educational well-being. All of it.
Wow, that covers everything.
It does. It's about viewing the child as this whole interconnected person, not just, say, treating an ear infection in isolation.
Mm-hmm.
And the crucial context here, which often gets missed, is that this whole effort, this pursuit of well-being, it needs to happen within a medical home.
Okay, what does that mean exactly, a medical home?
It means having that central, ongoing relationship with a primary care provider, someone who coordinates all the different aspects of care. And, just as important, it's rooted within a healthy family and community environment, because a child's health is just so tied to their surroundings and relationships.
So it's not just about the individual child in a vacuum.
Not at all. And the profound insight, really, is that this broad, holistic view is essential for kids because their health is just so deeply intertwined with their development stage, their family life, their school environment, everything.
Right.
So we're not just looking at, say, a child with asthma and just writing a prescription. We're thinking about their sleep, their nutrition, their emotional resilience, their social support at school, at home, even how their learning environment might be impacting stress levels and overall health.
So it's moving beyond just symptom relief.
Exactly. It moves way beyond just alleviating symptoms. It's about actively fostering overall health, building resilience, aiming for optimal development. You're trying to build this really robust foundation for them.
That emphasis on the foundation first. That feels like a really powerful shift, not just jumping straight to therapies. So what are those foundational health-promoting practices? What does that bedrock really look like for a child?
Precisely. That bedrock is fundamental. Think of them as the non-negotiables for a child's well-being, the basic building blocks that honestly sometimes get overlooked when we're just focused on treating sickness.
Right, the basics.
Yeah, and these practices form that primary layer of care. Ideally, they're established before you even think about other therapies because they address core needs and can actually prevent a lot of issues from even starting.
Okay, so what's first?
First, there's optimal nutrition. And using dietary supplements only where necessary to prevent actual deficiencies. This isn't just eat your vegetables. It's ensuring a balanced intake of everything vital for growth, brain development, immune function.
Like vitamin D.
Exactly. Making sure breastfed infants get enough vitamin D for bone health. immunity, or catching iron deficiencies early to prevent developmental delays and fatigue, that kind of essential nutritional support.
Makes sense. What's next?
Second, the avoidance of addictive substances. Things like nicotine, illicit drugs. This is so critical for developing bodies and minds. Adolescent brains are just incredibly vulnerable to the long-term damage these substances can cause. It's about proactive protection.
Absolutely. Crucial during those years.
Then, consistent physical activity, and this is more than just fitness, right? It's fundamental for musculoskeletal development, heart health, healthy weight, but also hugely important for mental health, managing stress, improving mood.
And social skills, too, through play and sports.
Exactly. It fosters social skills. Then there's adequate sleep. Again, not just rest. It's fundamental for cognitive function, memory, physical repair, emotional regulation in kids. Chronic lack of sleep. It can show up as behavior problems, learning issues, weakened immunity.
We all know how important sleep is.
Right, and often underestimated. Then, a healthy environment. This covers everything from clean air and water to safe living conditions, free from toxins or excessive noise, but also the broader social environment that shapes their daily life.
Okay. Anything else in that foundation?
Yes, finally, and this is huge, supportive social relationships. These are absolutely critical. Strong, positive connections with family, friends, the community that fosters belonging, resilience, emotional security, all foundational for well-being. These things together, they create that strong base where a child's health can really flourish.
It really paints a picture of comprehensive wellness, not just absence of disease. Okay, so once that foundation is solid, then we start talking complementary therapies, those specific treatments used alongside conventional medicine.
Exactly. Once those foundational practices are in place, integrated into the child's life, then integrative medicine might thoughtfully bring in evidence-based complementary therapies. And that evidence-based part is absolutely key. It's the filter we need to apply as we look at specifics.
Right, not just anything goes.
Not at all. These are used alongside conventional medicine, never as replacements for proven treatments, but to potentially enhance outcomes, manage symptoms better, or improve quality of life.
So what kinds of therapies fall into this category?
Well, it's quite diverse. You've got dietary supplements, which, as you said, are incredibly common. Vitamins, minerals, herbs, botanicals, we'll definitely dig into those.
Okay.
Then, various forms of body work. Things like massage for relaxation and therapeutic touch, and chiropractic care, focusing on the musculoskeletal system.
Like hands-on stuff.
Then movement-based practices like yoga, which blends physical postures, breathing, meditation, and Tai Chi, that sort of gentle exercise and meditation.
Mindful movement.
Exactly. And then a whole range of mind-body therapies. These really leverage that powerful mind-body connection. We're talking meditation, hypnosis, guided imagery, biofeedback.
Things that give the child some control.
Precisely. Tools for self-regulation. And finally, acupuncture, that ancient practice stimulating specific points on the body. The idea is always to choose therapies that have shown some level of efficacy and safety through scientific study. To truly complement, add layers of support, not substitute core medical care.
Okay, this is fascinating. Let's get into the prevalence now. You hinted it's more common than we might think. How widespread is this in the U.S., especially among kids? Is it niche or really mainstream?
Oh, it's remarkably widespread, much more than most people assume. It's definitely a significant part of modern pediatric healthcare now. The data suggests somewhere between 10% and 40% of healthy children in the U.S. use some form of complementary therapy.
10 to 40%, that's already quite a range.
It is. But here's the kicker. That number jumps to over 50% for children with chronic conditions.
Over half. Wow, what does that tell us?
Well, that higher rate in kids with chronic conditions is really significant. It's a profound insight, actually. It strongly suggests parents are actively looking for additional support, maybe feeling that conventional medicine alone isn't fully addressing persistent symptoms or improving quality of life enough, or offering a complete solution for these complex ongoing health issues.
Like for things where there isn't a simple cure.
Exactly. Think chronic migraines, persistent abdominal pain, things that are managed, maybe, but not fully resolved by standard methods. Parents in those situations are often highly motivated to explore anything that might offer extra comfort, better symptom management, just a better quality of life for their child. They're looking for tools, tools to manage daily challenges, maybe reduce reliance on pharmaceuticals, or just boost their child's overall resilience when a cure isn't on the table.
And you mentioned this might even be an underestimate because of non-disclosure?
Precisely. The prevalence could actually be even higher than these numbers show,
Yeah.
because these treatments very often happen without the parents telling the child's primary care doctor.
Creating that sort of hidden healthcare landscape you mentioned.
Exactly, a hidden landscape.
Okay, that non-disclosure point is critical, and we absolutely need to come back to why that happens and the risks. But first, sticking with prevalence, what are the most common complementary therapies parents are actually using? And what specific conditions usually lead them to seek these out?
Right. Well, the common therapies people use generally line up with that list we just discussed. It reflects what's most accessible or well-known. So things like dietary supplements, they're huge. Then deep breathing exercises, guided imagery, meditation, biofeedback, hypnosis, yoga, acupuncture, massage, and aromatherapy, often seen as, less invasive or maybe more natural options.
Okay. And the conditions driving this use?
When you look at the conditions that most often lead parents to seek these out, there's a very clear pattern. It's overwhelmingly among youth with chronic, incurable, or recurrent conditions.
Things that stick around.
Exactly. Significant, often debilitating diagnoses, like cancer, where therapies might help manage awful treatment side effects, nausea, fatigue, anxiety, depression, and other mental health conditions, where mind-body practices can offer coping skills. Asthma, maybe relaxation techniques help with breathing control. Autism, where therapies might aim to improve social interaction or manage sensory issues.
Headaches, stomach problems.
Yes, recurrent headaches, chronic abdominal pain, other persistent painful conditions. The goal there is often symptom management, improving daily function. For these kinds of issues where conventional treatments might be ongoing, have side effects, or just don't provide complete relief, parents are understandably looking for every possible tool to support their child. Anything that might offer extra comfort or a better quality of life.
It makes sense that parents would explore every avenue. But what about the medical establishment itself? Are hospitals integrating these, or are they still seen as kind of fringe?
No, not fringe at all, actually. The integration into mainstream healthcare, especially in pediatric hospitals, is surprisingly robust, and it's growing. There was a significant study back in 2017 looking at freestanding children's hospitals, those big specialized centers.
Right.
It found that an impressive 92% of them offered complementary services. 92%.
Wow, nearly all of them.
Yeah. And furthermore, 38% had specific complementary centers right there on site. That shows a real dedicated commitment infrastructure. And maybe most telling, 60% had established clear policies around using dietary supplements during a hospital stay.
So it's becoming embedded in care.
Absolutely. This isn't just a casual add-on. It signifies a real shift, a growing acceptance and integration into formal care pathways. You see it routinely used in very sensitive high-stakes areas, like pediatric cancer symptom management programs.
Hey?
There, these therapies might help kids cope with the really harsh side effects of chemo or radiation, the nausea, the pain, the anxiety. They're also widely integrated into chronic pain clinics.
What kinds of things are used there?
In those pain clinics, you often see evidence-supported therapies like probiotics, maybe for gut health or managing antibiotic side effects, and a lot of mind-body techniques like hypnotherapy, biofeedback, all integrated right alongside traditional medical management. It's about providing comprehensive, holistic care for these tough pediatric conditions. This integration really shows a shift in understanding how best to support the whole child through their health journey.
That's truly fascinating, the extent of integration in hospitals. But it brings us right back to that really critical, almost counterintuitive question. If hospitals are embracing these approaches, why is there still such a big problem with families not telling their primary care doctors? What does this hidden healthcare landscape really mean for everyone involved?
That's the profound insight, isn't it? That hidden healthcare landscape, created by non-disclosure, it's not just a communication breakdown. It means the providers, the doctors, are often working with an incomplete puzzle. Trying to provide effective care becomes like a guessing game. And crucially, it puts the burden of assessing complex medical risks onto parents who just don't have the necessary expertise.
Right, they're not pharmacists or toxicologists.
Exactly.
Yeah.
And this widespread non-disclosure, it's a major concern for patient safety and for coordinating care effectively. Even with growing acceptance in some places, many families just don't feel comfortable, or maybe they just don't think to tell their primary care providers about all the supplements or therapies they're using.
And that lack of information can lead to real problems.
Absolutely. Potential hazards,
Okay.
especially dangerous drug supplement interactions, which we'll get into, or just misinterpreting symptoms. Imagine a doctor trying to figure out why a child has unexplained fatigue or digestive issues, completely unaware that a particular herbal supplement could be the cause. It could lead to unnecessary tests, wrong diagnoses.
Wasted time and resources and potential harm.
Precisely. Recognizing this critical gap, several major health organizations have put out guidelines, really urging healthcare professionals to take a more complete dietary supplement history. The Joint Commission, for example, they're a major accreditation body for hospitals, specifically recommends including supplements in the medication reconciliation process.
What's that exactly?
Medication reconciliation is that critical safety step where healthcare providers review all the medications a patient is taking, prescription, over-the-counter, and yes, supplements to avoid errors, especially when patients move between care settings or start new meds.
So supplements should be part of that check.
They absolutely should be. The importance of this communication, this disclosure, just cannot be overstated. It ensures the whole healthcare team has the full, accurate picture of everything a child is taking. That allows them to provide the safest, most effective care. Without it, potential adverse effects, dangerous interactions, they could easily be missed. And that puts the child at unnecessary risk.
Okay, let's zoom in then on the biggest category here. Dietary supplements. You said they're the most frequently used. It sounds like a huge umbrella term. What exactly are we talking about, and how are they legally defined in the U.S.?
Right, it is a huge umbrella. When we talk dietary supplements, we're referring to products defined by that key piece of legislation, the 1994 Dietary Supplement Health and Education Act, or DSHEA. The definition is a product taken by mouth that contains a dietary ingredient intended to supplement the diet.
Okay, dietary ingredient sounds pretty broad, too.
It is very broad. It covers a really wide range of things. Familiar stuff like vitamins and minerals, think vitamin D for infants or iron for anemia, often medically recommended. But it also includes much more diverse categories, herbs or other botanicals like peppermint or ginger, amino acids, enzymes, even things like organ tissues, glands, and metabolites.
Glands, wow.
Yeah, and probiotics, those beneficial microorganisms, also often fall under this umbrella. So you have some uses with good evidence, like probiotics for antibiotic-associated diarrhea, but then you have other uses, like maybe various herbs for ear infections, where the scientific evidence is much weaker or controversial. The sheer variety is a key part of why this area is so complex.
That breadth is genuinely surprising. But okay, if they're so widely available, so common, you'd almost assume they face the same tough testing as prescription drugs, which brings us to a really interesting, maybe concerning point. What about regulation? Is it as strict as for a new pharmaceutical?
This is the crucial distinction, and it's where so many misunderstandings and, frankly, potential dangers come from. The profound insight here is that the very label supplement fundamentally changes its regulatory journey. Supplements are essentially presumed safe until proven otherwise by the FDA. That's the opposite of pharmaceuticals.
Wait, presumed safe, not proven safe first.
Exactly.
Yeah.
That single regulatory difference basically guides their entire market and safety profile. It's critical, and most consumers just don't realize it. In the U.S., dietary supplements do not undergo the same stringent evaluation and post-marketing surveillance as prescription meds. They don't have to prove safety and efficacy to the FDA before they hit the shelves, like a new drug does.
So the FDA isn't testing them beforehand?
Not routinely for safety and efficacy approval. While the FDA does have some regulatory oversight, like setting manufacturing standards, the burden of proof for safety generally falls on the FDA to show a product is unsafe after it's already being sold. It flips the responsibility compared to drugs.
That's a massive difference. How does that affect what they can claim on the label?
It significantly impacts their claims. Dietary supplements are legally forbidden from claiming to prevent or treat specific medical conditions. That's a hard line. However, they are allowed to make what are called structure function claims. These describe a general effect on the body's structure or function. So, for example, a label might say a product promotes a healthy immune system. That's a structure function claim.
But it can't say.
It absolutely cannot claim to cure the common cold because that would be treating a specific medical condition. This subtle but incredibly important difference reflects that lower regulatory hurdle and the presumption of safety rather than requiring proof of efficacy and safety up front. Essentially, this lack of pre-market approval means consumers are largely navigating this on their own, trying to evaluate these products without the same assurances they get with medications.
Okay, so we have this broad definition, a very different regulatory path. How common are these specific products, dietary supplements, among kids? Do we have real numbers showing how widespread this is?
Oh, we definitely do. And the numbers really drive home just how embedded these products are in children's lives. According to the NHA-NES data, the National Health and Nutrition Examination Survey from 2017-2018.
Right, the big national survey.
Exactly. It found that a significant 34% of children and adolescents reported using any dietary supplement in the past 30 days. 1/3.
1 in 3 kids. Wow. What kind were most common?
By far the most common were multivitamin mineral products, used by 24% of children. So roughly 1 in 4 kids is taking a multivitamin.
Okay. Are there patterns in who uses them?
Yes, there are definite demographic trends. Supplement use is most common among children from families with higher income and education levels.
Why do you think that is?
Well, it often correlates with greater access to health information, maybe a more proactive approach to wellness, and simply more disposable income for these kinds of products.
Yeah.
Use is also more common if the parents themselves use supplements, sort of a modeling effect.
Makes sense.
It's also higher among older children, maybe due to more autonomy and exposure to health trends. And, as we already discussed, significantly more common among kids with chronic conditions, reflecting that search for extra support. So yeah, the data clearly shows these products are widespread across various groups of children.
Okay. Given how common they are, it's easy to just assume they're safe. But, oh, here's where it gets really unsettling, right? What are the safety considerations, especially for children? They're often more vulnerable. Does natural really mean harmless here?
That is such a crucial assumption to challenge, because natural absolutely does not automatically mean harmless, particularly when you're talking about a child's developing body and metabolism. Now, overall, serious toxicity in kids from non-prescription supplements is much less common compared to prescription drug issues.
Okay, that's somewhat reassuring.
It is, but it's vital to be clear.
Yeah.
Toxicity does occur, and the potential for it depends heavily on several things interacting. The specific dose being used, whether other therapies or prescription drugs are being used at the same time, creating those dangerous interactions, and, critically, the child's underlying medical condition. Certain conditions can make a child far more susceptible.
Can you give an example?
Sure, let's take ephedra. Remember that. It was widely used in weight loss supplements, but uncontrolled use led to serious heart problems, even deaths, and it got banned.
Right, I remember that controversy.
Yet traditionally, ephedra ma huang in Chinese medicine was used in very small, controlled doses in specific formulas for allergies or respiratory issues. It highlights how the safety profile can totally change based on preparation, dose, and how it's used.
So context is everything.
Absolutely. And even herbs that seem safe for most healthy adults can be much riskier for kids in vulnerable situations. Like newborns, their metabolic systems are still immature, or kids with impaired kidney or liver function that affects how they process and clear substances.
Or after surgery.
Yes, special circumstances, like after an organ transplant or major surgery, where their physiology is altered, maybe their immune system is suppressed. And of course, the risk shoots way up when supplements are combined with prescriptions. Plus, we have to remember some natural products are just inherently toxic. They contain compounds that are harmful.
Even things that seem okay.
Even seemingly benign products, used incorrectly, can cause problems. Take peppermint oil, often used for gut cramps, right? But give it to a child in the wrong way, maybe too much or not enteric-coated, it can actually worsen gastroesophageal reflux, causing painful heartburn. The nuance here is just vital. Natural doesn't equal safe, especially for a developing child.
That's a really stark reminder. Okay, so beyond the actual ingredients themselves, what about how these things are made, the manufacturing process? Are there like hidden dangers for families there?
This is another really significant and often totally overlooked area of concern. It exposes some genuinely hidden dangers, even though there are regulations called good manufacturing practices or GMPs for supplements in the U.S.
Right, there are some rules.
There are some rules, but there's still this persistent, alarming problem. Supplement labels might not accurately reflect what's actually inside or the concentration. We're not talking small variations sometimes. Because of natural differences in plants, inconsistencies in processing, variations of 10-fold, even up to an incredible 1,000-fold, have been reported for the concentration of active compounds in popular herbs.
1,000 times.
Yes. And this can happen even between different batches from the exact same manufacturer. Imagine needing a specific dose, and the product you get is 10 times weaker, or worse, 10 or 1,000 times stronger than labeled. That's a massive risk for both effectiveness and safety.
That's terrifying. What else? Contamination?
Yes. Beyond inaccurate labels and dose chaos, contamination is a real risk. Pesticides from farming, microbial agents or toxins if hygiene is poor during harvesting or processing, even the wrong herb being accidentally picked and included.
Misidentification.
Wow. But here's where it gets particularly alarming, demanding critical attention. Products from some countries, for example. Certain Ayurvedic remedies from South Asia have been found to contain toxic levels of heavy metals, mercury, cadmium, arsenic, lead.
How does that happen?
Sometimes it's unintentional contamination from soil, water, equipment. But more disturbingly, sometimes it's intentional. Some traditional practices involve adding these metals, believing they have therapeutic value, despite clear scientific evidence of their toxicity.
They add lead or mercury on purpose.
In some traditional contexts, yes, believing it has medicinal properties. And then, even more critically, studies have found that around 30% to 40% of Asian patent medicines contain potent pharmaceuticals, hidden drugs.
What kind of drugs?
Things like painkillers, antibiotics, drugs to lower blood sugar, even powerful corticosteroids. And the labels, typically not in English. And crucially, they don't mention these hidden pharmaceutical ingredients at all.
So parents think they're giving an herbal remedy.
Exactly. Thinking it's natural, but they're actually giving potent prescription-strength drugs without any medical supervision, proper dosing, or awareness of side effects or interactions. It's incredibly dangerous. And it's not just obscure products. Even standard mineral supplements like calcium have had issues with lead contamination or significant variability. These quality control issues are widespread and present very real hidden dangers. It makes informed choices incredibly hard without much better regulation and transparency.
This leads straight to the next critical question. Beyond contamination, weird labeling, what happens when these supplements interact with prescription drugs? Given how common both are, this feels like a major minefield.
It absolutely can be a minefield. And it's exactly why that open disclosure to doctors isn't just a good idea, it's essential for safety. Many families, often completely unaware, use supplements right alongside prescriptions. And that mix can pose serious hazards because of complex interactions. We can think about it like drug interactions. The same principles apply. Let's walk through some key examples from the source material because these specific interactions really illustrate the broad risks.
Okay, let's hear them.
Okay, consider aloe vera taken orally with glibenclamide, also known as glyburide, a diabetes medication. Oral aloe gel can actually increase the drug's effect, significantly raising the risk of dangerously low blood sugar hypoglycemia.
Right.
Then there's bitter orange, sometimes used in weight loss products, with phenelzine, a type of antidepressant. That combination dramatically boosts the risk of hypertensive crisis, a sudden, dangerous spike in blood pressure. Life-threatening.
Okay, that's serious.
Very serious. Garlic, often taken for heart health, if used with antiretrovirals like ritonavir or sequinavir, vital for HIV patients, can actually decrease the effectiveness of those crucial drugs, potentially leading to treatment failure.
Undermining the main treatment.
Precisely. Licorice, found in some remedies taken with warfarin, the blood thinner. It increases the risk of bleeding because licorice interferes with how warfarin is metabolized.
Okay, what about grapefruit? I've heard about that one.
Ah, yes, the classic example. Grapefruit, especially the juice, interacts with many common drugs, like certain calcium channel blockers used for blood pressure. Grapefruit inhibits a key enzyme in the liver and gut wall called CYP3A4.
CYP3A4 sounds technical.
It is, but think of it like a specific cleanup crew enzyme in your body that breaks down many medications. When grapefruit inhibits it, that crew can't work properly, so the drug hangs around longer, levels get higher than intended, potentially reaching unsafe levels and increasing side effects.
Got it. More drug effect than planned.
Exactly. What else? Melatonin, the common sleep aid, combined with zolpidem, like Ambien, significantly increases sedation, excessive drowsiness, impaired function. Similarly, valerian, another popular herb for sleep or anxiety, combined with sedatives like alprazolam or phenobarbital, dangerously increases central nervous system depression, could even affect breathing.
Okay, sedation interactions.
Then there's golden seal. This one's critical because it inhibits two major enzyme pathways, CYP2D6 and CYP3A4. Together, these pathways metabolize something like half of all common prescription drugs.
Half.
Roughly half. So golden seal can cause levels of many different medications to rise unexpectedly, increasing the risk of side effects across the board.
That's a huge potential impact.
It is. And then there's St. John's wort, widely used for mood. This one is notorious because it does the opposite. It induces CYP3A4 activity. It speeds up the metabolism, the elimination of drugs using that pathway.
So the drug gets cleared too fast.
Exactly. Leading to subtherapeutic levels, the drug doesn't stay in the system long enough or at high enough levels to be effective. This can cause treatment failure. And this is critical for drugs like cyclosporine and tacrolimus, the immunosuppressants for transplant patients. Reduced effectiveness could mean organ rejection.
That's incredibly high stakes.
Extremely high stakes. It also decreases the effectiveness of warfarin, risking clots, protease inhibitors for HIV, digoxin for heart conditions, theophylline for asthma, then venlafaxine for depression, and crucially, oral contraceptives, potentially leading to unintended pregnancies.
Failed birth control. Wow.
These examples, they highlight just how serious the risks are. Organ rejection, bleeding, failed contraception. The potential for harm is very, very real, which is why, and I know we keep saying it, but it's so important, you must disclose all AL supplements, no matter how natural or harmless they seem, to your healthcare providers. That information is literally life-saving. It allows the team to provide the safest care.
Okay. So after covering all these really critical points about safety, manufacturing, interactions, let's circle back to efficacy. Do these supplements actually work for the pediatric problems they're often used for? Is there strong, consistent evidence?
Right, the efficacy question. When it comes to proving that dietary supplements prevent or treat pediatric problems, the evidence is, well, it's quite mixed, highly variable. It really depends heavily on the specific product and the specific condition being addressed. So it's definitely not a simple yes or no across the board.
So some might work for some things, others not.
Exactly. Some herbal products may be helpful as adjunctive treatments, meaning they could potentially offer some support alongside conventional medicine, but very rarely, if ever, should they be considered a sole or first-line treatment based on current evidence.
Okay, adjunctive and may be helpful seem like key qualifiers. Can you give some examples where there is some positive evidence?
Sure. There are a few areas where specific herbal remedies have shown some promise. For infant colic, which is just incredibly distressing for everyone.
Oh, yeah, been there.
Right. Certain herbal combinations have been looked at, specifically fennel, and also a combo of chamomile, fennel, vervain, licorice, and balm mint have shown some helpfulness in reducing those colicky symptoms.
Yeah.
Maybe by calming the digestive tract, maybe a mild sedative effect.
Okay, colic. What else?
For nausea, think motion sickness, or maybe nausea from chemotherapy, ginger has a really long history of use, and there's some decent evidence supporting its effectiveness as an anti-nausea agent. It seemed to act on receptors in the gut and brain.
Ginger for nausea. Yeah, I've heard that.
It's pretty well established. For irritable bowel syndrome, IBS, that chronic gut disorder, peppermint oil, usually in special enteric-coated capsules so it reaches the intestines, has shown it can be useful. Often helps with discomfort, bloating, pain by relaxing the smooth muscles in the gut.
Peppermint for IBS?
And probiotics, those beneficial live microorganisms. There's a growing, quite robust body of evidence supporting their use, especially for various types of diarrhea, particularly preventing or treating diarrhea associated with taking antibiotics by helping restore a healthy gut microbiome.
Probiotics seem pretty accepted now.
They are gaining wider acceptance based on stronger evidence for specific uses. So yes, there are areas of potential benefit, but again, the emphasis has to be on adjunctive and may be helpful. Their role is typically supportive, efficacy varies hugely, and they absolutely must be discussed with a healthcare provider to ensure they're appropriate and safe within the child's overall treatment plan.
Okay, let's shift gears now. Moving from things you take internally to therapies involving physical touch, manipulation. Let's talk massage and chiropractic care in pediatrics. What's the scene here? How are they used? What are the perceived benefits? And crucially, what does the science say about efficacy and safety for kids?
Right, let's start with massage therapy. This is very common, often seen as quite reassuring in pediatric care. It's frequently done informally at home by parents, which really speaks to its accessibility and perceived comfort and safety.
Like parents massaging their babies.
Exactly. But in more formal clinical settings, it's done by professional massage therapists, physical therapists, even nurses trained in specific techniques.
And in hospitals, too.
Oh, yes. Notably, infant massage is actually routinely provided in many NICU's neonatal intensive care units.
For the really fragile newborns.
Yes, for those very delicate babies. In the NICU, it's used specifically to promote growth and development in preterm infants. That shows a level of acceptance even in highly sensitive medical environments.
That's interesting. What about for older kids?
Beyond the NICU, massage has shown benefits for kids with various conditions. For instance, children with asthma, gentle massage might help reduce anxiety, potentially improve respiratory function. For kids with insomnia, it can promote relaxation, maybe lead to better sleep. For colic, gentle abdominal massage can sometimes soothe that digestive upset.
Okay.
It's also found to be helpful for kids with cystic fibrosis, possibly aiding breathing exercises, for managing pain and stiffness in juvenile arthritis, and even for patients undergoing cancer therapy, helping manage nausea, pain, fatigue, improving comfort, and reducing anxiety.
So quite a range of potential benefits. What about safety and regulation?
Safety-wise, massage therapy is generally considered very safe,
Mhm.
especially when done by a trained professional or a parent who's learned proper techniques. Professional practice is regulated at the state level, usually through licensing, registration, or certification. Over 44 states license massage therapists, which is the strictest form, ensuring standards of training and conduct. So overall, broad acceptance, demonstrated benefits in some areas, and a generally low-risk profile make massage a widely integrated and well-regarded complementary therapy.
Okay, that sounds pretty positive for massage. Intuitive, low risk, regulated. Now, what about chiropractic healthcare? How does that compare? Scope, prevalence, and most importantly, the evidence for efficacy and safety in children. Is it as clear cut as massage?
Right, chiropractic healthcare. Broadly, it deals with diagnosing, treating, and preventing disorders of the neuromusculoskeletal system, nerves, muscles, bones, and how those might affect overall health. It's a very established profession. Over 70,000 licensed chiropractors across all 50 states. That's a significant presence.
And insurance covers it mostly.
Yes, most medical insurance companies do cover chiropractic care, which shows a level of mainstream acceptance, at least in terms of payment. And families often seek it out for common childhood issues: asthma, infantile colic, bedwetting, nocturnal enuresis, constipation, headaches.
Okay, so people are definitely using it for those things, but connecting this back to the bigger picture and our goal of really understanding the evidence, is the evidence for chiropractic in kids as clear as it seemed for massage, especially for those common conditions?
This is where we see a really significant, crucial difference. And it's something parents absolutely need to be aware of if they want to master this information. A consensus update reviewing the scientific evidence on chiropractic care, specifically in children. It found no evidence for the effectiveness of chiropractic care for those common childhood conditions it's often sought for.
No evidence for colic, asthma, bedwetting.
According to that comprehensive review, no robust evidence supporting its effectiveness for those specific pediatric conditions. That's a critical point.
Yeah.
While many seek it, the strong scientific backing just isn't there currently for those particular issues.
Okay, that's a big finding. What about safety? Massage seemed very low risk. Chiropractic.
On safety, the evidence is also limited. Now, it's important to say that published cases of serious adverse events in infants and children getting chiropractic care are rare, considering how many treatments happen.
Okay, rare is good.
Rare is good, but, and this is a big but, they do occur. And the potential complications, though infrequent, can be devastatingly serious.
Like what?
Specifically, documented complications from cervical manipulation that's manipulating the neck
Right.
include vertebrobasilar dissection leading to stroke.
A stroke in a child from
Ooh.
neck manipulation.
It means tearing a key artery in the neck, supplying blood to the brain, which can rarely lead to a stroke.
Yes. Another rare but documented complication is the rupture of a syringomyelia, that's a fluid-filled cyst inside the spinal cord, which can cause paralysis. These are incredibly severe outcomes, even if rare.
They are severe, devastating outcomes, which is why the recommendation is absolutely clear. If families are considering or seeking chiropractic care for a child, it must be done following consultation with the child's pediatric primary care provider.
Talk to the pediatrician first.
Absolutely essential. To discuss the known risks versus the unproven benefits for these specific pediatric conditions, ensure safety, and make sure it doesn't interfere with other necessary medical care.
Are there other concerns besides the direct manipulation risks?
Yes, there's also a documented concern about chiropractors sometimes giving medical advice that goes beyond their specific expertise. For instance, some studies have noted that a significant percentage, maybe up to 30%, hold beliefs about vaccines having significant side effects, which conflict sharply with established scientific consensus and public health recommendations.
That could lead to confusion for parents on critical issues like vaccination.
Exactly. It raises that important question. How do parents sort through conflicting advice from different practitioners, especially on really critical public health topics? It just highlights the absolute need for critical thinking and open, honest dialogue with the primary care provider who has the full picture of the child's health.
Okay, let's pivot now. Let's talk about therapies that really focus on that deep connection between the mind and the body, how these can be used to help kids manage conditions. This feels like a really empowering area, teaching self-regulation skills.
It absolutely is empowering. Mind-body therapies are among the most frequently used complementary approaches in pediatrics, precisely because they give children and their families tangible tools for self-regulation and coping. They leverage that undeniable link between our mental state, our emotions, and our physical health.
What are some common examples?
Things like slow, deep breathing exercise is fundamental, various forms of meditation, guided imagery, biofeedback, hypnosis, and also those movement practices we mentioned earlier like Tai Chi and yoga, which have strong mind-body components.
How do kids typically learn these?
One of the great things is their accessibility. They can be learned informally through books, online videos, CDs, DVDs, smartphone apps these days, or through structured classes, or often very effectively in formal therapeutic sessions with trained health professionals, psychologists, social workers who can offer personalized guidance.
Can we dive deeper into some specific practices and how they're used for kids to really get a handle on this for mastering the information?
Definitely. Let's look at Table 7.3 from our source material, essentially. Take biofeedback. This technique helps people gain voluntary control over physiological processes that are normally automatic, like heart rate, muscle tension, skin temperature.
How's that used in pediatrics?
Effectively for preventing migraine headaches. It teaches kids to relax muscles, maybe regulate blood flow patterns, reducing headache frequency and severity. Excellent for reducing general stress and anxiety by promoting relaxation. For gut issues, it's used to treat encopresis, fecal incontinence, and constipation, helping kids learn better control over bowel muscles. Also for stress incontinence. And a specific type, neurofeedback, focusing on brainwaves, is used adjunctively for ADHD, helping improve focus, attention, self-regulation.
Okay, biofeedback sounds versatile. What else?
Deep breathing. Sounds simple, but it's profoundly effective. Fundamental for relaxation and immediate stress management. Teaching kids breath control helps calm their nervous system, slow heart rate, regain composure during anxiety or pain.
Guided imagery.
Guided imagery, using mental images to promote relaxation, reduce stress, manage pain. Great for stress management, anxiety reduction. It can be a powerful tool for pain relief, distracting the mind, fostering calm, like imagining a favorite peaceful place during a procedure.
Hypnosis. People might have misconceptions about that.
Right, clinical hypnosis isn't stage hypnosis. It's a focused state of attention, used effectively for correcting habit disorders like thumb sucking or nail biting, for preventing headaches by managing triggers or tension, and for managing various types of pain through suggestion and altered perception.
Meditation.
Meditation, focusing the mind to achieve mental clarity and calm. Beneficial for overall stress management and can significantly improve concentration and attention span in children, teaching them to quiet the internal chatter.
And Tai Chi and yoga?
Tai Chi and yoga both combine physical postures, breathing, mindfulness, excellent for improving balance, coordination, concentration, and discipline, offering really holistic physical and mental benefits.
What's really fascinating here, looking at this list, is the potential impact. Does the research back this up?
Yes. What's compelling is the substantial body of research suggesting these practices can significantly help reduce anxiety, improve insomnia, and alleviate stress-related conditions. This includes those tough chronic issues like migraine headaches and functional abdominal pain, which can be so debilitating for kids. They also offer non-drug ways for patients struggling with chronic pain to manage symptoms and improve their quality of life. The real power, as you said, lies in empowering kids, teaching them to actively participate in their own healing and well-being, giving them invaluable self-regulation skills for life.
Okay, from inner focus now to maybe external energy flow. Let's delve into acupuncture. Ancient roots, but increasingly seen in modern pediatric settings. It might seem intimidating, right? Especially for kids, with the needles involved. How is this ancient wisdom applied for modern pain relief in children?
That's the immediate reaction, isn't it? The needles. And it's a valid concern.
Yeah.
But let's unpack it. Modern acupuncture, while definitely rooted in traditional Chinese medicine, actually pulls from treatment traditions globally: China, Japan, Korea, even France. It's got a rich, diverse history.
And it's regulated.
Yes, in the U.S., acupuncturists are licensed to practice in 47 states. That indicates widespread recognition and regulation. And it is being delivered to kids in various settings, hospitals, clinics, for a range of ailments.
You mentioned pain earlier. Is that a major use?
Absolutely. It's important to emphasize acupuncture seems particularly useful for children experiencing pain. That's where its integration into conventional medicine is really strongest, a key indicator. Over half, more than 50% of North American academic pediatric chronic pain programs offer acupuncture right alongside conventional medicine and psychology.
So it's part of the standard toolkit in specialized pain clinics.
Exactly. It's seen as a valuable component of comprehensive, multidisciplinary pain management.
What does the treatment actually involve? Is it just needles?
The technique studied most scientifically does involve penetrating the skin with very thin, solid metallic needles. These are then manipulated by hand or sometimes with electrical stimulation to activate specific points. However, and this is crucial for kids and parents worried about needles, there are many variants of acupuncture that don't involve needles at all.
Oh, like what?
Things like rubbing, known as shiatsu, applying heat near the skin called moxibustion, using low-power lasers or magnets on the points, applying focused pressure, that's acupressure, or using gentle electrical currents through pads on the skin. These non-needle options make it much more accessible and child-friendly.
Okay, that's really good to know. So how do kids actually react? Do they tolerate it?
It addresses that common perception of needle aversion. And yes, it's a valid concern. But when it's approached in a developmentally appropriate way by an acupuncturist specifically trained in pediatrics, children are often surprisingly amenable to it. And importantly, they often report that it's helpful.
So the practitioner's approach is key.
Absolutely. A skilled pediatric acupuncturist knows how to engage kids, build trust, make them comfortable, use age-appropriate techniques, maybe start with non-needle methods. The potential benefits are significant. Relief from recurrent headaches, anxiety, back pain, other types of pain, depression, abdominal pain, nausea. It seems to work by influencing the nervous system, maybe releasing endorphins, modulating inflammation.
What about safety? Needles still carry some risk, right?
Yes, safety is always a consideration. Infections and minor bleeding are rare, but possible with any skin penetration. Usually localized and minor if done by a licensed practitioner using sterile single-use needles. More serious complications like a pneumothorax, a collapsed lung are extremely rare, like less than 1 in 30,000 treatments rare. So while risks exist, they're generally very low with trained professionals. Effective communication, building trust, and that child-friendly approach are really the keys to successful, safe acupuncture in pediatrics.
Okay, finally, let's tackle a really current, often debated topic, cannabis, and its implications for children and adolescents. This is such a complex area with laws changing, public perception shifting. It must be confusing for families and doctors.
Indeed, it's remarkably complex, rapidly evolving, and really fraught, with both potential for very specific conditions and significant risks, especially for the developing brain. The widespread legalization of marijuana in many states, for recreational adult use and for medical use, has naturally led families and caregivers to ask about potential health benefits for kids too, often driven by anecdotes or just general buzz.
But there are major concerns.
Absolutely crucial to highlight.
Yeah.
There are significant safety concerns, specifically for adolescents and young adults, because the detrimental effects of marijuana, particularly THC, the psychoactive part, on the developing brain, they've been extensively documented.
What kind of...
Well, to put some data on it, one big systematic review, looking at 90 studies covering over 9,000 adolescents and young adults, found preliminary evidence for actual functional and structural alterations in specific brain regions among adolescent cannabis users.
changes in the brain structure?
Yes, observed in the frontoparietal, frontolimbic, frontostriatal, and cerebellar regions. Basically, these are areas critical for higher-level stuff: decision-making, planning, impulse control, frontoparietal, emotional regulation, motivation, reward, frontolimbic, habit formation, goal-directed behavior, frontostriatal, and coordination, balance, motor learning, cerebellum.
So really important functions.
Critically important functions, and this raises that vital question: what are the long-term implications of these brain changes on cognitive development, mental health, school performance, overall functioning as these kids mature? The research strongly urges caution because the adolescent brain is just particularly vulnerable.
But you mentioned potential benefits for specific conditions.
Yes, and it's very important to make this specific, nuanced distinction. While general recreational or even broader medical marijuana use in adolescents carries these significant risks, there is a very specific, highly regulated therapeutic use for one component. In some children with severe refractory epilepsy, meaning seizures not controlled by standard meds, oral cannabidiol, or CBD, which is a non-psychoactive component of marijuana, has been shown to significantly improve seizure control.
So CBD, not THC, and only for severe epilepsy.
Exactly. This is a very targeted medical use, often involving prescription, pharmaceutical-grade CBD products like PEDIATRICS. These undergo rigorous testing, are prescribed by specialists, closely monitored. It's completely distinct from the unregulated cannabis products you can buy commercially.
And those commercial products are a different story.
Completely different. Outside of that prescription CBD context, the purity and regulation of marijuana and all its commercially available forms, edibles, vape oils, tinctures, it's incredibly variable. Lack of standardization makes it really hard to know the actual content or potency. That brings risks of inconsistent dosing, unknown contaminants.
And another risk you mentioned earlier, accidental ingestion.
Yes, a growing and very alarming safety risk, highlighted repeatedly in pediatric literature, the sharp increase in accidental ingestions in young children. This spike is almost certainly linked to the flood of cannabis products, especially edibles, available for adult use in homes, particularly where recreational use is legal.
Because they look like candy or cookies.
Exactly. Often packaged attractively, resembling familiar snacks, highly appealing but dangerously accessible to toddlers and young kids. Unintended ingestion can cause serious toxicity, severe drowsiness, breathing problems, even seizures. Often requires emergency care, hospitalization. This accidental ingestion is a significant growing safety risk that pediatricians really need to be aware of and counsel families about proactively. That tension between the perceived benefits, often anecdotal, and these documented risks, especially for vulnerable kids, makes cannabis a uniquely challenging area to navigate responsibly.
Okay, we have truly taken a deep dive here into this multifaceted world of complementary therapies, integrative medicine, and pediatrics. We've covered the definitions, the prevalence, dug into supplements, massage, chiropractic, mind-body therapies, acupuncture, and this complex cannabis landscape.
We really have. And to summarize the key takeaways for you, the listener, striving to master this, I think they're clear and compelling. First, integrative medicine offers this really holistic vision for children's well-being, moving way beyond just symptoms to encompass the physical, mental, emotional, spiritual, social, educational health, all within that supportive family and community context.
Right, the big picture.
Exactly. Second, there's this diverse range of therapies, from those foundational health practices forming the bedrock to specific complementary treatments like supplements, massage, mind-body techniques, acupuncture. But third, and this is critical, you must scrutinize the efficacy and safety data for each. Understand that natural doesn't automatically mean safe or effective, and that regulation, especially for supplements, is vastly different from drugs.
The evidence matters.
Hugely. And finally, the absolute necessity of open, honest communication with healthcare providers about everything being used. All therapies, all supplements, it's just fundamental for safety, preventing dangerous interactions, ensuring coordinated, comprehensive care. Knowledge truly is empowering as you navigate this complex and evolving landscape.
So what does all this mean for you listening as you move forward armed with this deeper understanding? Our goal, remember, was to give you that inside track, help you feel truly confident and well-informed, ready to navigate this with clarity like the elite professionals. As you think about these approaches for pediatric health, consider that delicate balance, the balance between seeking that holistic well-being for a child and navigating a landscape where, frankly, not all therapies are equally understood, equally regulated, or equally backed by solid science.
It's a constant balancing act.
It is. How will this comprehensive understanding shape your next conversation with a doctor? Or inform the health decisions you make for the children in your life? It's definitely an ongoing journey of discovery in pediatric health, isn't it? And your informed agency, your ability to ask the right questions based on this knowledge, that's truly your most powerful tool